Good morning, everybody. I'm going to call to order the May of 24 meeting of the Special Committee on Academic Health of the University of Minnesota Regents. Thank you to everybody who's joining us in the West Committee Room. Well, today's meeting is not being live streamed. Recording will be uploaded and archived to the board's YouTube channel after today's meeting. Just a quick reminder that the West Committee Room has room-wide microphones, so please make sure you are projecting when you speak, and I'll ask those in the audience to limit their side conversations as well. With that, let's move to our first agenda item. Our first agenda item is to receive an update on the mHealth Fairview Partnership. That's one of the purviews of the charter of this Special Committee on Academic Health, is to look at partnerships. We'll hear today from the consultants engaged at the university to assist with the transition. I will note that myself, Vice Chair Ruth Johnson, who can't be with us today, who's across the seas, and Board Chair Mayron have had an opportunity to have some initial conversations with our consultants to frame today's discussions. I will also say that I came away with those conversations really reassured that they're looking at the model in the right way with the right degree of expertise. This is a big deal for the University of Minnesota, and I feel good with the people that we've engaged, and hopefully you will see that too in our presentation today. Today's conversation will provide an update on where we are and what we will look for in the coming months. So first, I'm wondering, Vice President Toller, if you'd like to introduce the group. Thank you.
Thank you, Madam Chair. Thank you, everyone. Thank you for being here today. This is truly exciting because today this committee will hear from a group of excellent consultants and excellent experts in the field so that we can have the team assembled for the right way of the transition to the true academic healthcare system at the University of Minnesota. What will happen next is that I'll hand over to Cliff Stromberg, whom many of you know because he has been associated with the university for decades now, and they will introduce themselves and continue. Before I do that, though, I would like to express my gratitude to the university and the university leadership for committing to this high-quality advice and this high-quality process whereby we can be not only guided to a better future, but also provide a truly meaningful reassurance to the faculty, to the students and staff that I serve, and in this way transform the whole landscape into an optimistic, bold, and actionable. Madam Chair. Cliff?
Well, thank you. Good morning to the Regents and everyone. I'll be brief because we have worked together for some time. But for the record, I'm Cliff Stromberg. I lead the Academic Medical Center and Healthcare Transaction Practices at the law firm of Hogan Lovells. We're one of the world's largest law firms with offices in major cities around the world, including Minneapolis. Today, we're here to discuss a potential transaction which the university would acquire from Fairview, the core University of Minnesota Medical Center facilities. I and my team have deep experience in that kind of transaction. I personally have helped to negotiate hospital transactions for more than 20 major universities, which is almost surely more than any other team in the nation. We have a very deep group at Hogan Lovells. Last year, just for example, we worked on tens of billions of dollars of transactions, and we were named the Healthcare Law Practice Team of the Year by Law 360. We've learned over the years from lots of very fine institutions, and as you work on these for many years, you see something about what works, what doesn't work, and what appears to work at the beginning, but over time is not a durable basis for a relationship. So we hope to bring that experience to bear and working with the university and helping you go forward. If I can, Dr. Toller, shall I proceed to just tee up the other consultants?
Yes, please.
The university went through a process of considering a number of potential firms to assist them in other areas, finance, operations, and so forth. And so now I just want to introduce our colleagues, Keith Gezi and Jean Tkachek from Alvarez and Marcel.
Thanks, Cliff, and good morning to the Regents. It's a pleasure to be with you. Just a few words about my background. I'm a board-certified emergency physician. I've practiced and taught emergency medicine for over 25 years, and I've been working in managing and consulting for medical schools and teaching hospitals for almost 40 years. I previously served as the medical director and chief operating officer of George Washington University Hospital and as the chief operating officer of Inova Fairfax Hospital, which is the flagship of the Inova Health System in Northern Virginia. I earned my MBA in finance from the Wharton School and have been consulting since 2001 full-time, predominantly in and around academic medicine and in and around transactions. Probably one of the highlights of my career and something very applicable to what we're talking about here. I served as the CEO of West Penn Allegheny Health System in Pittsburgh and led a team which authored and implemented the turnaround plan there through regulatory approval and acquisition by Highmark. My colleague Jean Tkachek, who I'll turn it over to in a second, and I have recently worked with the University of California, San Diego, St. Louis University, and the University of Virginia. I also understand what your role. I served as a trustee of my alma mater, Washington and Jefferson College, for the last 14 years. I chaired the board for 4 years during COVID and the presidential search committee recently. And I'm most proud, and I want to underline most proud, to see my esteemed emergency medicine colleague, Dr. Rebecca Cunningham, serve as your next president. Dean?
Thank you, Keith. And good morning, everyone. My name is Jean Tkachek. I'm also managing director at Alvarez and Marcel, a close colleague of Dr. Gezi. Cliff Stromberg and I have worked together on a couple of engagements historically. Keith and I have worked together, as he mentioned, extensively. My background is primarily in finance. I'm a CPA by background. I started my career in public accounting and spent the majority of my 35-plus year career as the chief financial officer of the faculty practice University of Arizona. I've been a consultant now for nearly 10 years, and the majority of my clients have been in the academic space. I've worked with practice plans in hospital systems, working on performance improvement engagements. Keith mentioned the University of San Diego, the University of Virginia, the University of St. Louis, and other similar engagements where we've accomplished significant turnaround and restructured the practice plan as well as the health system. My experience in this transaction space also dates well back to the beginning of my career, and most recently focused on 2 transactions with the University of San Diego. One is complete and one remains in process. So it's a pleasure for me to be part of this esteemed team. We've been highly engaged with your team and have been impressed with their engagement around the subject, and we're excited to get to work and try to help you move this transaction along to its decision point. So again, thank you for allowing me to be here this morning.
And now thanks, Jean. I think we can now turn to our colleagues at Raymond James. I should make it clear to everyone, each of the consultant areas of expertise, and we all work together. Raymond James will be advising primarily on valuation issues and financial assessment of the business. And so I can now turn it over to Vinton Rollins and Richard Laurenti.
Good morning, everyone, and thank you very much. I'm Vinton Rollins. I'm a managing director within Raymond James, which is a New York Stock Exchange financial services company. We have extensive experience in working with academic medical centers, which have included the university assisting on a project with UCARE in 2016, Mayo Clinic, Georgetown University, George Washington University, St. Louis University, Rush University, and many others. So we're pleased to be a part of the team.
And I bring up the back of this team. I'm Rich Laurenti. I'm Managing Director at Raymond James and co-head of our healthcare finance group. Vinton and I have worked together almost 30 years or so. We had co-founded a investment banking boutique in healthcare called Shattuck Hammond Partners. We are now, as Vinton said, part of Raymond James. Our focus is not-for-profit healthcare industry, and that's broadly defined. Vinton mentioned the academic medical centers that we've worked with. We also have experience with physician group practices, managed care companies, senior living. It's across the board in healthcare finance with a focus on not-for-profit organizations. Our resources and services include capital markets activities and merger and acquisition advisory, including valuation. And as Cliff mentioned, that's what our focus here will be, is on valuation services. We appreciate the opportunity to be presenting today. Thank you.
Well, thank you, everyone. Madam Chair, unless you have something else that you want to have us address right now, we can proceed to just a few of the slides in the slide deck.
Be great to proceed. Thank you, Cliff.
Okay, I understand there's some wonderful person in the room who is going to be teeing up the slides. If we could go to slide 4, appreciate it.
This is the next one.
There we go. So I'm sure everyone in the room wants to know, why are we here? And we'll be brief about this. The short answer is it's no surprise to anyone. There have been, long-running challenges and difficulties in the university-Fairview relationship, as perceived on both sides and by many other stakeholders as well. And so it behooves any important institution always to think about, is there some better way that we can manage this critical enterprise for the state? So we've also noted that many universities, both public and private, operate directly their own hospitals and health systems. You could look at Ohio State and Michigan and University of North Carolina, Duke, Penn, Stanford, et cetera. So in that light, Fairview and the university agreed to a letter of intent dated February 9, which contemplated the acquisition by the university of the core UMMC facilities, East Bank, West Bank, Masonic Children's Hospital, and the business within the CSC. The university already owns the building itself. The transaction has a life cycle, which we've tried to simplify and depict here. We are now in the due diligence stage, which involves disclosure of information. It is critical to any transaction that both sides understand the same facts. And so there's a process by which the seller of assets makes available all of the relevant information, and our ability to proceed will depend upon that occurring. We're now working with Fairview to that end. Along the way, you also solve problems. You work collegially. Nothing goes perfectly smoothly, but we've all been through these transactions and we've gotten to the end successfully. I think one of the things that we on the university side certainly feel very strongly is we all have to elevate our vision. Squabbles don't help anyone. Frictions don't help anyone. What's at stake here is a lot more than just buying some buildings or transferring ownership and operation of some services. This is a unique public asset in Minnesota, as in any state, and we all have to elevate our sights and think about serving the public interest first. And that is not to say that we know the public interest. We fortunately have university leadership and regents and processes to get input, but we are trying to keep our minds focused on that. If you could go to the next slide, please. So the letter of intent is fairly straightforward. There's one feature of it that may not be intuitive to people, so it's worth our explaining it for a moment. The transaction will be completed ideally in 2 phases. The first we've postulated would be completed at the end of this year, 2024. Like all target dates, it may be optimistic, but we're going to work like heck to try to get to that goal. And the university would acquire 51% ownership, and we'd have a joint 50-50 governance in phase 1 for a couple of years. Then in phase two, the university would obtain the remaining 49% interest and be the sole owner and operator of UMMC. Why 2 phases? This is not unheard of. As you can imagine, transferring operations as complex as multiple hospitals, dozens of clinical services is very complicated. It's pretty typical to have a transition services agreement in which the prior operator continues their IT systems and their HR systems and all of that for a period of time while an organized handoff is achieved. And that is something that Alvarez Marcel has enormous experience on and would be working on. You don't want any glitches in it. Obviously, there are thousands of employees involved, and they deserve an organized process as well. So we're thinking that there will be an interim period. We've said it could, we in Fairview have agreed it could continue until the end of 2027. I think all of us feel like it's likely that it would be much shorter than that, but the virtue of the arrangement is you can execute on the handoff in an organized way, and when you're ready, you're ready. Obviously, we emphasize all of this transaction will be subject to applicable federal and state regulatory review, and we would go through that process. And of course, any transaction involves not just price, but lots of operational terms. We would negotiate the definitive agreements. And at the end of the day, we would bring back the final proposed agreements to the university leadership and to the Board of Regents, and they have the final say, as well as the Fairview Board, of course. Okay, I think we can now go to the next slide, and I'll hand the baton to Keith and Jean.
Thanks, Cliff. And I won't dwell on this slide. We've talked about this a little bit, but just wanted to explain briefly the roles to the Regents. Clearly, we're reporting to a group of university and UMP physician leaders who are responsible for managing our engagement, strategic direction. Hogan Levels and Cliff are responsible for leading the negotiations and many of the aspects of the diligence, and we are in the diligence phase. We're providing support to that, and we will be developing a financial model under Jean's leadership, a pro forma of what the acquired assets would look like, performing ideally on a go-forward basis. And then, as Vinton mentioned, they're responsible for evaluation, supporting the negotiation, and debt issuance should it be necessary. In this diligence phase, we've requested a significant amount of information from Fairview. The information we've requested is typical in these transactions. It's important and it's essential for us to be able to do our work in the financial modeling, to also evaluate the assets in terms of how they can perform, and then for Raymond James to do their evaluation. And as you can see, Fairview, of course, has their leadership team. They have counsel engaged, and they've engaged Kaufman Hall as both their financial and valuation advisors. We're collaborating with them very closely in this diligence and will be on a go-forward basis. And then finally, the parties are finalizing an engagement with Deloitte to do what's called quality of earnings. For those Regents who aren't familiar, there's a lot of noise or one-time unusual events that occur in the financials of any company, especially a healthcare company, especially during COVID. And we need to normalize or control for that. And the parties have asked Deloitte to do that in a joint engagement. On the next slide, please, slide number 7. Cliff mentioned most of this, so I just want to point out a few things. You'll see dates in brackets because they're always subject to change. Transactions are living relationships, and they do change over time. We're very much in the midst of the financial due diligence phase, where the parties need to be able to evaluate the financial aspects of the transaction. And the next major decision point will be after a preliminary valuation has been performed by Raymond James and Kaufman Hall, and we have an opportunity to see how those valuations may align. And I just wanted to ask either Vinton or Richard if they wanted to comment on the valuation.
Comment. The standard that we've been charged with is fair market value. And so what that implies is as the business is operating now and not including changes at the university or other contract changes in the future.
Thanks, Vinton. And then Cliff really talked about the 2 phases of the transaction going forward. So in the interest of time, I'm going to move past that and ask Jean to comment on how we're managing the transaction and transition and a little bit about Fairview's financials. Jean?
Thank you. Thank you, Keith. The two organizations have agreed to develop a governance structure to monitor the progress of the transaction, which is important for a number of reasons. Likely most importantly is to ensure appropriate communication to the organization's respective governing bodies. But they've agreed to develop this joint steering committee. Each organization will have its own executive coordinating teams in place. They've agreed to establish a transaction management office, which we, along with Kaufman Hall on behalf of Fairview, will staff to ensure that, most importantly, the issues involving operations are identified and appropriately deliberated through this oversight structure. The oversight structure will have a number of work groups assigned to it that would range from what you would expect, finance, legal, compliance, but also include operating areas such as clinical services and of course the impact of the transaction could be significant, will likely be significant in the research and academic missions of the university. So there will be a group within this transaction management office that will work to identify those potential issues and again ensure that any risks are mitigated and issues addressed prior to the transaction, so that when the change of control happens, those issues would be appropriately monitored again to ensure that the missions, the clinical, the academic, as well as the research missions are attended to pre-transaction, during the transaction planning, and also in the post-transaction phase.
Jean, just a reminder to advance the slides.
Yeah, I would move just quickly to slide 10. There has been historic interest in the financial condition of the partner Fairview. The purpose of this slide is just to aggregate some publicly available information about the Fairview organization. Similar to other organizations that we've experienced through and post-COVID, many healthcare systems continue to work through the implications of the COVID period of time, and Fairview is no exception. You can see here, based on these financial statements, that the organization is on a growth path. Their revenues have increased nearly 10%. They, like other organizations, continue to deal with inflationary pressures, particularly those impacting their labor market. They have put into place a performance improvement effort, which has yielded significant improvement in the operations since it started last year. Margin pressures continue as they do for similar systems across the country, and their cash position has not recovered to pre-COVID levels, again, which is not unusual for organizations in this industry. The rating agencies have responded, as you can see there. Both organizations now put a stable outlook for Fairview, and the Fairview team has reported that they're projecting a break-even operation for fiscal 24. And Vinton or Richard, and if you wanted to add any comments to these financials.
No, Gene, that was a good summary.
So Cliff, it's back to you.
Well, thank you. I don't think we really have anything else to present. We're happy to answer questions. I guess one thing I should make clear, it's implicit, but most people hearing about this kind of transaction assume that because it's so important to the mission that it definitely is going to occur. And unfortunately, that isn't the case. The university believes this is an important, historic, strategic opportunity we're all going to work like heck to try to make a success of this, but any transaction depends on agreement on financial terms, price, operational transitional terms, and many other things. So we don't want to leave the impression that this is a certainty. It is something we're working very hard on, and time will tell whether we can get to the finish line.
Thank you very much. I appreciate that, and appreciate the expertise of all of you are bringing to this really important endeavor. With that, I'll ask if there's any questions of the committee members, or any comments, Board Chair Mayron, you want to make, because you've had an opportunity to be exposed to this group as well.
The answer is no.
Okay.
No questions, no comments right now.
Okay, great. Thank you.
I'll just, on slide 11, I think it is, we talk about, the university's partial university and UMP physicians. How is UMP involved in the process?
Well, very deeply, we and they are completely locked arm in arm, and they're in the meetings and in the planning. UMP would continue to be in its current structure, which ultimately is accountable to the Regents. And so they would particularly be important, and perhaps Keith and Jean can address this, in terms of the planning for operations after the university was, operating the UMSC. But UMP is itself going through a whole analysis, because all large groups are under financial pressures of how they can best meet their mission. But the short answer is they and we are doing this together.
Yes, Dean Toller.
Madam Chair, I'm just going to add, for the benefit of everyone, that the practice of the medical school, which is the UMP, the physicians, is a part of the university, is a part of the medical school. And in this function, the Regents in April 2017 instructed us that we should come even closer than before the UMP and the medical school. And in this way, the Vice Dean for Clinical Affairs in the medical school serves as the CEO of the practice, and I have the honor of serving as the chair of the practice board. Madam Chair.
Thank you. Thank you, Vice President Toller. Any other questions? I have one question. Obviously we need a lot of data from that's disclosed by both parties, but by Fairview as well, to make a determination about how this works, how it will work the best, how economically feasible it is. Where are we at in receiving the necessary data to make those determinations?
Keith, do you want to address that, or Jean?
I can start, and then I'll ask Jean to weigh in. We've requested, as I mentioned, Chairman Wheeler, a significant amount of data. I'd say we've gotten on the financial side about half of what we've requested. And it's really important, though, to understand we've asked for it in a certain way, to be organized a certain way, and some of that data is readily available. Some of it needs to be collated and modified in order for us to be able to use it. Fairview has predominantly been focused on the financial aspects thus far, so that we can get to the valuation, and some of the other information has been lagging a bit behind. Jean, what else would you add?
I would just add to the comment that the amount and the thoroughness of the data will drive will drive the range of the valuation. The more and more thorough the data, and more narrow the range of the valuation will be. And also, as it relates to the future looking pro forma, the better we will be at trying to estimate the operations of the entity post-transaction. So we are planning to have a meeting very soon with the Kaufman Hall consultants who have represented Fairview for this portion of the transaction, to really get to, in more depth of the data, to try to ensure that we have enough and enough information to really move forward and provide good estimates of future operations as well as evaluation.
Great. It's very helpful, Jean. Thank you, because obviously getting that requisite information will then give us a better idea of what the model looks like to be successful in the future. So thank you. Any other questions or comments that people want to make? I will say that Vice Chair Dr. and Regent Ruth Johnson, not being able to be here, but she wanted to say that with her meetings with the consultant, she's also feels like that they are doing great experts that we have involved to look at the breadth of this and the model that will move us forward. So wanted to add that in as well. All right, thank you. Well, with that, we'll move to the next agenda. I want to thank the consultants very much for being available and presenting this morning. Thank you very much.
Thank you.
All right. Good. I think that, I hope people have seen, as I have seen, that we've got some really good expert advice on operational components and what this change will mean for the university. We've got the partnership structure, the operational, the economic, sustainability will be looked at by this esteemed group. I think then switching to our next topic, it's ours as the University of Leadership to look at, this is a public institution that serves the needs of Minnesotans. How are we best using our assets of the university to serve those needs? So while the operational spectrum and the economic model and the partnership model is going to be informed by the consultants, it's largely ours to clarify, give the strategic clarity needed to make choices going forward. So I'm happy to move to the next agenda item, which provides a special committee with an opportunity for leadership from each of our 6 health sciences to discuss their collaboration and provide an update on their collective strategic plan, which was a key priority that came out for those of us that were on the governor's task force for academic health. We wanted to have all schools here at one time to highlight the interconnectedness that these schools have with each other and serve our community and state. To help guide our conversation, as I mentioned, I Vice Chair Ruth Johnson, Board Chair Mayron, along with the help from the Office of the Board of Regents, developed the questions that are included in the revised docket item summary. Our goal was to have a framework to help guide the creation of a health sciences strategic plan, create points that the board could engage in the development of plan, and help the deans understand what the board is interested in. Today's discussion will focus on items 1 and 2 with future discussions building on the economic model that follows, which is item 3 of the framework that we put forward. So with that, I want to welcome our incredible health sciences deans, Dean Connie Delaney of the School of Nursing, Dean Keith Mays of the School of Dentistry, Dean Laura Moldgard from the College of Veterinary Medicine, Dean Melinda Pettigrew, welcome for the School of Public Health, Dean Linda Welledge for the College of Pharmacy, and obviously Dean Jacob Toller for the School of Medicine. To kick it off, I will turn to Vice President Toller to start us.
Thank you, Madam Chair. Thank you, everyone. And I am, of course, delighted to be joined by my fellow deans from all these schools that you have just mentioned. We have always known that we are unique in our multitude and our synchrony and symbiosis since the 1970s that the Academic Health Center started. We are, however, energized by the attention of the task force and this committee, thank you, to focus on the strategic planning that we have an honor to present to you today in the first version of this. So the task force has asked that we develop a strategic plan around the 6 health science schools, and I'll remind the group that we are one of the only 4 such universities in the United States that have the enormous benefit of being able to learn from each other and work with each other. And we have been asked to focus on interprofessional relationships, on the partnerships that we have throughout the state, and also, as Chair Wheeler so well instructed us in the process of developing of this strategic plan, focused predominantly, if not only, on what are the interfaces, what are the, not what happens in the individual schools necessarily, but really what happens on the combination of the schools together, so that we can focus that unique nature of what we can offer to the state in a way that is truly unique in this fashion. So the strategic plan should, of course, include goals and strategies, and these goals and strategies better be pretty muscular and better be metric-driven, because as we all know, articulated expectations are future results. And in this way, we have focused on the obviously high-quality care. We have focused on rankings that the regions desire for the reputational value, and of course the magnetic value of the university to attract the best and brightest regionally, nationally, perhaps even internationally into our schools, and also to have a very good clarity around the delivery models so that we can present our discoveries in the individual schools and the schools, in the sixth health science spectrum as tools to intervention in the clinical realm. So that is in the way that it changes the lives of people who live in the state of Minnesota, and is, in fact, as simple and as existential as taking what's tragic in lives of people, injury, disease, and whatever, to treatable. And in this way, offer uniquely what we can as the university to the people who live in the state. Next slide, please. So the vision is essentially an overlap with our mission. When I think of vision, I think of what are the problems that we need to solve? Not just some air castle, but really, very practical. And then underneath that is the organization that can help solve these problems. And underneath that are the resources. I'm grateful to Chair Mayron to remind us, frequently that this board is willing and this university is willing to help us along the way of developing of the strategic plan over the majority of this year with resources that may be needed for external review or firm or one of the other components of such process. We are the state's only R1 university, and in this way we have I think, obligation. We have an accountability to the state to truly deliver on that position. And it's not in the research alone, but really in the way how training and research transforms in the clinical care, and how uniquely we can build true teams that can then collectively have the social impact across the health and healthcare and the social determinants of health that we all know are so categorically imperative in everything that we do. So we are, across the training, across the research, across the practice, we are bridging missions, we are bridging disciplines, and we are bridging the whole state. I want to be very clear that our impact and our executive mandate, if you will, is the whole state, not just the big cities and not just the Twin Cities alone. And we feel that we may be positioned in a unique way also that we can come upstream in the health and healthcare so that we can focus on the value-based care, on whole body, whole person healthcare, in contrast to other players in the healthcare ecosystem in the state, and we can focus on prevention rather than intervention, because absolutely everyone that I know would rather not come to the hospital and to the operating room, but rather, have these, whatever they are, strokes, MIs, and others, prevented before they actually become a problem. It is also important. This is a beautiful, noble, and large university. In this way, we collaborate not just amongst the six of ourselves, but also with other schools. Science and engineering is a major player in academic health, as we all know. College of Design, law, in the policy, and CSUM for that matter. So we have that unique network across the university that is our obligation. And again, I'm grateful for the leadership of the board and the task force to make us essentially to focus on that hierarchical almost approach to this, so that we can deliver at the end of this process. So with this, we will improve the training. We will address some of the vexing problems of the healthcare, and we will be the players in the workforce development. And that is, as everybody knows, not just the the quantitative, number of dentists and nurses and vets and pharmacists and people who work in public health, but it's also the maldistribution of these individuals across the state. We all know about healthcare deserts, then in this state and in the greater America in general. And with these, we will be working very diligently to address these with the statewide look and make that as a part of the as a pillar almost of this quest. With this, Dean Mace.
Good morning, Regents. One of the unique attributes of the University of Minnesota Academic Health Sciences is a vast array of partnerships that we have across the state. We are able to leverage this because of the fact that we do, as Dr. Tola alluded to, provide the workforce averaging between us ranging from approximately 50% to plus 70% of the practitioners who are in the state. We provide care to millions of Minnesotans, and we intake students at the rate of 50% to almost 70% in our different various schools. So I think we have a really good way of kind of leveraging and impacting the state. I want to just highlight a few of our partnerships and things that we do. I'm going to focus a little bit on what we do at the School of Dentistry, but it will kind of also show some of our collaborative things. So one of the things that the CDC speaks to is that there's 1 in 1,700 births will result in a cleft palate or lip. The School of Dentistry is the home of the Cleft Palate Clinic in Moose Tower and provides unique team-based care in which we have people from dentistry, medicine, nursing, speech languages, audiology, and others to take care of patients in a team-based fashion. We see approximately over 500 patients in that team-based manner annually. So it's a great impact and a great need. Additionally, one of the things that happens is the majority of the dental students rotate to rural Minnesota and to provide care to patients in areas like tribal clinics, Scenic River Dental Clinic, Central Care in Wilmer, Hibbing Community College, Cass Lake, and Red Lake Hospitals. And so we have a great impact on the state, just what we do with our students, and so also what we do locally. As well, we are providing care to underserved communities such as the People Center, North Point Health and Wellness Clinics, and as well the health sciences collaborate utilizing mobile clinics to treat underserved. The dental school has its own mobile clinic that goes across the state and provides care. So we are able to really leverage partnerships to provide care to a lot of Minnesotans through collaborative nature and through our individual schools. And so next, Dr. Welch.
Thank you. And thank you, Regents. It's my pleasure to be here, and I want to re-stress some things that were already said, and that is collaboration. You can't get anything done in today's world without that. It's the secret sauce, and I will say that's one of the reasons I came to the University of Minnesota years ago, because the health sciences had that reputation back to the 70s of collaboration, and it's only grown stronger. And I think with this opportunity given us to have designed the strategic plan in partnership not only with the health sciences, but with others in the state, as well with others in the university, we strengthen that collaboration, and we will strengthen the output, which will improve the health of Minnesotans. I want to talk a little bit about process and what we've done. And I know process is sometimes sort of boring, but it's important to know our journey and that we're working forward. And so in that journey, it was really important to recognize the individual strengths of each school. Because these are all top health science schools, and I hope the Regents in the state are proud of that. We are proud of it. But it's even more important to recognize our collective strengths. We're more powerful together than we are alone. And so we've talked about those areas over the years, and now I've coalesced it even further. We reviewed each of the schools' current strategic plans, how they connect with the state, what our different activities are, and how we can improve health through education, through research, and through practice. And then worked on identifying the strategies and shared goals that Dean Toller talked about. We will be evaluating, have already started, peer institutions. How do they do it? similar to that due diligence, and how they do it in an integrated manner. But we've identified some core principles already, and the underline is our 3 mission areas for the health sciences. You can think of education, discovery, or research, and care, or practice. I want to say whenever I say those 3 words, it sounds like 3 separate words. They're not 3 separate words, and I wish we could come up with a word that really shows the intersection, because it is the intersection in 3 dimensions that they're always working together at this university. And in doing that, we picked 6 sort of focus areas. Obviously, workforce, whether that's expanding workforce, which is needed, or dealing with the misalignment of workforce, training future workforce, but also retraining existing workforce in every sense. It's partnerships, and that can be in the university, but it should also be throughout the state and throughout our communities. And all of our schools have that, and we've done some work together, but are thinking in that dimension. Rural, where we see many of those deserts. It's not the only place we see health deserts, but many of them are in our rural communities. Research or discovery, where we can create cures or preventions. Practice, and then where we can care and use our skills, or in managing the underserved. So those are the 6 sort of focus areas we see coming forward. But with those 6 focus areas, again, they're not separate pillars. And they're interconnected, even though I presented them each as separate. And so I'm excited as we move into this to get down into the details and share those in the future with you. But I'll now move on. Linda.
Great, thank you. So Melinda Pettigrew, I'm the newest dean here, and I came here in January, and I just want to reiterate some of the things that were said. One of the reasons that I came here was because of the 6 health science schools. It is a gem, it is unique, and I'm really honored to be able to participate in this process. And we really are greater than the sum of our parts. And so I'm excited to see this move forward. I'm going to talk a little bit about the timeline. And the timeline starts up there in May, but please be assured that this work started before May, and we really started in earnest specifically with our planning process in April. And there we spent much of the month really working to identify our values and strategic priorities. And here I want to emphasize that we really focused on shared values amongst each of the 6 schools. We focused on values that we think are important for the state of Minnesota and our role in serving the state of Minnesota. And we focused on identifying strategic priorities. And as Dean Tolar mentioned, these were not priorities of the individual schools. These were shared priorities amongst each of the 6 schools. In May, which is now, we've been working to finalize this draft of the strategic plan. And in this process, we've also been thinking about who we need to communicate this with and who we need to consult. So we've been developing survey and feedback materials, and then identifying partners that we will want to work with through this process. And this is really intentional to ensure that the right people are at the right table and are consulted, and that people are not left out. In June, we're going to conduct the actual feedback sessions with many of the schools and our stakeholders. We're going to launch the feedback and survey materials, and we're going to present the draft to the Special Committee on Academic Health. We anticipate in June, July that we will do the external review process, and we're also going to be consulting more broadly with stakeholders, faculty and staff from each schools, UMN stakeholders, many folks across the university, science and engineering, law school, et cetera, and again, the external reviewers. In July, we hope to aggregate the feedback and prepare a report. And then in August, the health science deans are going to review the feedback and incorporate the changes and the comments that we've heard from members of our community. In September, we plan to be done with this process, but strategic plans have life, they will evolve. But we'll present the final plan that we have at the Special Committee on Academic Health in September at this time. Thank you.
One of the things that is important to all of the health science schools is advancing health, and advancing health through our care for Minnesotans and through the education process for our students and what they contribute to our state. And one of the things that we realized when we started to look at our individual strategic plans is there were areas in which we had similar values and principles, and they were key for us to be successful. One of the things we've said it before, but again, we'll thank you for this charge to do this. We had already started to do some things along these lines, and the way that we've realized was a key is that we needed to be able to co-create things. And so we each in our individual schools had strategic plans and goals and missions and visions, but we needed to co-create what was going to be the health sciences. And so this process allows us to really do that. And so as we looked at our strategic visions and goals and plans, we saw that there were several areas that we had in common. And they were collaborating with each other, and that was going to be very, very vital for us. One was excellence and really training our students to be excellent, training our providers to be excellent, providing excellent care for the state. Diversity, equity, and inclusion was very vital to us. It's very important to the future workforce, and so it's very important for us to lean into that space. We always want to be innovators, and we always think knowledge is important, and service and leadership was key. And so these are the things that when we looked across the landscape of what we were doing individually, where we could co-create and collaborate, and we were thinking similarly. And so these are the areas in which we're going to use our going to be key principles and values as we finalize our strategic plan. Dean Williams.
I'd like to focus on examples of key strategic initiatives. As I do that, I'd like to do a little bit of a weave. Going back to you, Dr. Toller, you mentioned the health sciences and basically being birthed in the 70s. So we actually have over 50 years plus of co-creating and continuing to evolve the matrix that we live within. And these examples, as well as others you've heard, are populating that matrix with the values that you articulated, Keith, on behalf of all of us. I'd also like to make a comment that both Linda and Melinda have highlighted, which is true for me too. The existence of the health sciences schools here and the uniqueness of our standing as one of 4 such entities in the nation is a key decision maker for me coming here. And 3, before I talk about some examples, is that what I discovered upon arriving, Melinda and Linda, we've talked about the same thing, is it wasn't just talk. It's, that common phrase, there's something in the water here. Well, there is. And people live it within the health sciences, this university, and the state. So, as we transition to some specific key initiatives, you see too that they are organized in the traditional parts of our mission, education, discovery, and care. I'd like to highlight, Linda, a comment you made is although they look like pillars, not any one of them exists in and of itself. They're always doing a dance across all 3. So focusing on education, there has been a lot of effort and continuing priority on increasing and enhancing K-12 and the pathways into our undergraduate programs. Interprofessional training sites have expanded, whether it's within this urban area or rural. And across these educational opportunities is the emphasis on underserved. We've been, of course, supporting and expanding One Health, not only at the University of Minnesota, but throughout the state, where all the professions work together in this exploring the pipeline and our academic programming, and working further to establish a health workforce development and science program. I particularly want to highlight the assets we have across our system as well. So the health sciences are in some smaller ways and in larger ways, I'm going to say interdigitating with every one of our campuses. I want to particularly highlight at this one our outstanding partnership with UMR. That crosses several of our professional areas. UMR does a magnificent job on not only recruiting and has a fine record in expanding our diversity, but the key is UMR is one of our key pipelines, pre-med, pre-farm, pre-nursing, et cetera. And then I'll move on to discovery, the research, the scholarship. We are embedded in a full culture of discovery. So here again, it's not a single pillar. When we are exploring pipeline, developing pipeline, there's a science and scholarship that underlies all those activities as well. And as I progress next to care, the scholarship and research are embedded in care. We have been expanding partnerships with communities across this state. We work together to define needs and collaborative solutions. There are a couple that you're going to see my comments expand out to system and other assets, if you will, in the state of Minnesota. And an example here in partnerships and also expanding research capacity, I want to highlight that we are the prime public R1 institution in the state. We also partner with other public and private entities, and we partner with Mayo. We have outstanding research partnerships there, and we partner with HCMC with their subsidiary research. One of the primary ways we've done that over the years is through our Clinical Translational Science Institute, which involves all of our schools and colleges in a very deep, broad, and leadership way. And then key other additional comment under discovery or our research is expanding on the concept of evidence or science is the foundation of healthcare, no matter where we deliver. The other key aspect about that is we are a key producer. I want to say the key producer, while recognizing our partners, of the science, or one might say best practices, whether they're in education or when they're in care. I'll transition to care now. The interdisciplinary team models exist among and across our schools, as well as we expand in the community, particularly around special or specific and needed healthcare issues, two of which I want to mention. Of course, the mental health crisis, local, state, and beyond. And we partner together to continue to expand our processes and partnerships in that space. Gerontology is another. Jakob, you mentioned deserts, and we are so involved in the community, whether, and I know this seems strange, in the state of Minnesota, but food deserts existing right here within our urban area, as well as surprisingly in our rural communities. Food desert issue is horrendous. And then a last key point under care is our clinical trials expansion. And that's one of the key roles of a university such as this and these health science schools. There is an underlying point that I'd like to make, particularly about care. It is the call of a university like this, and you've heard us ascribe to the fact that we are scholarship-oriented in everything we do, and the purpose of that is to actually feed, partner, and collaborate with all care delivery, I'm going to call them sites, but gifts in this state that range all the way from medical centers to our critical access hospitals and our community and public health. So with those comments, I'd like to highlight that workforce, you can see, permeates all three of these areas that are constantly interrelated. So I want to mention an example of the Mintersection project, which is anchored at the University of Minnesota Rochester, the School of Nursing, so you're seeing partnerships. The key on that Mintersection project, two comments about it. It is about how do we not only attract, but support and ultimately transition new healthcare workforce. It's starting in nursing. The whole focus of that project is interprofessional. And interestingly enough, it was designed not only to maximize the pipeline and the creative educational approach to training that UMR represents, it also welcomes two other entities, Mayo, and it welcomes the Center for Nursing, Equity, and Workforce. So you can already see the expanse of it is not just nursing. And the expanse of it is attracting even junior high or grade school people into the health professions. It crosses professions ultimately. It's most importantly designed to realize that if we don't tend to actually well-being, et cetera, from the second we meet, and foster that through education and the clinical experiences and the transition of people into workforce, they don't have the skills, I want to say, stamina in our current healthcare system to persist. So with that last example, I'll transition it. Laura?
Thank you. So we've been sharing some examples of why we're better together and how the sum is greater than the parts. And we've talked a bit about our process and planning, but there are resources that are needed to fulfill the initiatives, and then I will transition to some stories of where we've been, where we are now, and where we can be. So in order to do more than what we are already doing, we are going to need resources to invest in the workforce. And what I mean there is the university workforce. We're already working flat out. Our faculty and our staff are very, very committed to working individually and together to achieve all of the examples that we've shared with you so far. And we are already doing all we can within this aging infrastructure that you're already well aware of. We will need funding to expand access and service, research, and training, and we will need to address the healthcare cost and reimbursement models. And you're very well aware from our first topic this morning that we will need clinical facilities. But now I want to share with you some stories. So I'll begin with a story from the recent past. And it really highlights how our interprofessional teams collaborate to solve crucial, urgent problems. And these are clinical problems and they are public health problems. The most obvious was the recent COVID-19 pandemic, because this was an excellent example of how the health science schools came together to tackle unprecedented challenges across the workforce through partnerships in urban and rural practice settings, and especially in underserved communities. So our interdisciplinary efforts yielded groundbreaking discoveries in vaccine development, antibody testing, clinical trials of drugs, monoclonal antibodies, vaccine efficacy, drug repurposing studies, public health interventions, modeling, data analysis, health equity research, to name just a few. And we are uniquely positioned to conduct and translate research from bench to bedside and into communities and policy. So this is one of those stories that could not have happened without the contributions of all 6 schools. That's a past example. Now I'll transition to a current example. So for years, our 6 health sciences schools have been leaders in providing culturally competent care in resource-limited communities. And you've heard a few of those examples already. So one, consider the Phillips Neighborhood Clinic, where students from dentistry, pharmacy, medicine, nursing, and allied health professions come together to deliver desperately needed care for patients with unmet needs, while honing clinical skills and fostering cultural humility. Or initiatives like the Student Initiative for Reservation Veterinary Services, or SERVS, where veterinary students work alongside veterinary nurses and pre-veterinary students from CFANs to provide care for pets and introduce Native youth to STEM careers. Similarly, CUC, the Community University Healthcare Center, has served patients in South Minneapolis for over 50 years, equipping our students to collaborate with team members, engage with community members, and partner with patient advocates in delivering care to diverse patient populations. These populations predominantly consist of individuals facing economic challenges and dealing with complex medical and mental health conditions. Now we'll fast forward to what's possible. You've likely heard of these past successes and current successes, but I want to highlight what's possible through our collective potential. This year, we are embarking on a new venture with funding from a philanthropic foundation to launch a pioneering One Health clinic. This pilot aims to create a model to train future health professionals to address complex challenges at the heart of families and their companion animals, recognizing the interconnected nature of human and animal health. Now, we know from both experience and from research studies that human health is inextricably connected to the health and welfare of companion animals, whether it be the shared health risks arising from social determinants of health, mental health challenges compounded by concerns for people's pets, or the opening of a portal into the health system when people disclose their own health concerns while accessing health for their pets. Healthcare is improved when all members of the family, including companion animals, are treated as a system. Imagine a clinic where practitioners from all of our health sciences are trained to recognize and address this critical interconnectedness. But the possibilities are even greater. We are working to improve care delivery through a learning health system model, enhance the state's workforce, and focus our research and innovation on the challenges facing Minnesotans. We have, as individual colleges and collectively, focused our work also and specifically in rural communities across the state, providing immersion for learners and desperately needed role modeling for our rural youth to see themselves as future healthcare professionals in any one of our 6 schools. Minnesota is already a pioneer in so many ways, and we can continue to blaze new trails through community partnerships to develop and study new models for the workforce of the future, serving the entire state and beyond. So now I'd like to turn it back to Chair Wheeler for questions for discussion. We've posed some here, but you may have different questions.
That was exceptional. Thank you all. And I mean, the power of all of you here together, and what a treasure that the state that you represent, that your faculty represents, that your teams represent, that your students represent, that your graduates represent. I mean, it's amazing what is done for the state of Minnesota, and for the possibilities are clear. And that was one thing that I think Dean Delaney, Dean Toller, and I heard in great evidence at the governor's task force. That everybody realizes how dependent we are on the University of Minnesota for a caring workforce, for the discoveries that you talked about, and for serving, the public in greater and more possible ways. So thank you for being here, and thank you for highlighting some of those things. So with that, I'm going to turn it to questions. I'll first start with Regent Hips.
Thank you, Chair. Thank you for your great presentation. Our Minnesota Real Life Avengers. That's what I want to call you guys, because that's what it feels like. The mightiest of mighty that are going to solve our, I really believe that. And, I'm going to go to what gaps or issues exist. Obviously, there's a funding issue and a people issue. So we're going to have to expand the number of people going into school so we have more people coming back to the whole state. And I like the prism, when it shines on the whole state, not just a circle in the middle. So that was a nice presentation too. But that was my first question is I think you have to push all of us hard on the investment that we need to make and the return on that investment so we can prove it to the state. That's number one. And number two, something that's changing fast, and I don't know if you can even answer that. I don't know if anybody can, but where does AI and technology fit into this equation? Because that's moving at the speed of light too, and as far as you get this plan done, and now they have this AI moving in and changes everything. You guys talked about that. That's my 2 questions.
I'd like to make a comment about it.
Sure.
All of our schools and faculty, staff, and students have not only talked about it, but identified the issues as well as, of course, the advantages of AI. One of the we have an initiative that's very interprofessional across computer science, engineering, et cetera, as well as the health professions on I'm going to say the interface of ethics and AI. That is a phenomenal, I'm going to say a Minnesota characteristic that also permeates the university and us. It's not just about what we can do and get, if you want to say, transactional impact now. What is the long-term implication of what we're doing, and most significantly, how we anticipate, discern, and actually drive the direction of the implementation of AI.
So maybe I could also add to it. As Dean Delaney said, we're all in that space, but I want to stress we're in it collaboratively with our other university partners and with other partners throughout the state. But importantly, we're using all of our missions. So we're training our students in AI and the pros and cons and the ethics, but we're also thinking about it as innovation and where should it be used and what are the limitations, and then how is it used in an evidence-based healthcare system.
Regent Verhalen.
Thank you. Good morning. Can you hear me okay?
Jen, thank you.
Great. Sorry, was that too loud? Is quieter better?
You're fine.
Okay. In looking at that last slide of topics for discussion, item number 2 on there was how do we tell our stories? How do we get the word out more broadly and enhance the storytelling? I think one item, and it was a personal interaction I had very recently with a family member, and this is to you, Dean Mays. They had received an estimate for some medical work, dental work at their regular dentist, and the dollar amount was quite high. And so they were referred, why don't you check the University of Minnesota's dental program and see if this is something they can do for you. This individual is so pleased with the work that they had done. Not only was the procedure that was recommended unnecessary, and they were able to do something at 10% of the original cost, actually less than 10% of the original cost of what it would have been to receive at the dental office. But they had the most pleasant experience working with both the student as well as the dentist who was advising them on that procedure. And it was something that student had never learned how to do. It was a unique experience for all of them, but it was something that this individual is now out there spreading the word. And so I think one thing we need to think about is it's not just us doing the storytelling, it's not just the university doing the storytelling, but it's every person who is touched by the university and the amazing care that they receive, whether it be from the teaching function, whether it be from the actual care function, et cetera, and finding those opportunities to amplify that, I think, is what we also need to think about, because every single one of those people are the storytellers, and it ties really nicely into the Dear Minnesota campaign that the university broadly is doing, but it just really hit home for me reviewing these materials this weekend, receiving this story this weekend, how those individuals and the people that you all and your students and your faculty and your professionals interact with are then out there sharing their positive experiences with the university, and really some of the not always cutting edge work that's being done, but even hearkening back to, oh wait, that is something that we used to refer, and let's try it, let's see how it works, and it actually does work. And so just something that really was highlighted for me in enhancing the storytelling is figuring out how to amplify each of those individual voices in addition to speaking for ourselves.
And thank you for sharing that and shining light on School of Dentistry. And it is important for us to share those stories, I think, wherever they can be shared. And unfortunately, there's always things don't work right, but it's always good to hear when things are, people feel so strong and positive. And just coincidentally, just 2 days ago at our school leadership, I shared a different story. I don't think it's the same one. Someone had written a letter to me, and it was a positive story about some interaction with our student. And so the dean didn't come in and complain at the leadership meeting, but I started the meeting with sharing a positive story, so it's a different twist. But I think it's even internally sharing it, because sometimes we get so busy doing the work that we forget that there are great things that are happening in people's lives, and we need to be able to share those.
Thank you, Dean Mays, and thank you, Regent Verhalen, for highlighting that. I know if Dr. Johnson was here, because she's emphasized storytelling so many times, she would appreciate that. And, you know, the stories told are really impactful in several ways, and there's no better storytellers than those who have been served and served well, too. So thank you for commenting that. I'll turn to Regent Turner.
Thank you, Chair Whelan. First of all, I have my own story in the sense of I'm so glad that we are focusing on getting people into the health sciences at such a young age of 12. I have been in healthcare for 52 years. And the reason I say that is because I started off as a candy striper in 1972. And that was back when the nuns, we actually worked as junior volunteers. Made beds, fed, entertained, you know, so I was around patient care since I was 12 years old. Because of that, in my mind, there was no alternative. That was now my way of life. That's why I've been in healthcare for 52 years, because and it was very popular at that age that you just went and did volunteer work wherever. And that directly went right into nursing assistant, went into, you know what I'm saying? It just became a way of life because I was caught at a young age. So I commend that we're going back to our roots as far as trying to, how we're gonna build up the workforce. And then secondly, I cannot let it go by, and I'll keep it together here. Once again, thank you to all of the health sciences as far as being a COVID ICU nurse and all the research and protocols and everything that came out of this university. When I was on the Biden task force, we were highlighted over and over again, Minnesota, and the contributions. So, okay, now I'll go into something that'll put the tears away. AI, please, 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 you talk about best practice. Hopefully we are on the cutting edge of best practice, and not only in being able to use it to its best potential, but that we basically need regulation. There's no regulation on it. I would love to see that we would be, as far as the balance between the workforce that we want to build up and AI and what's a proper amount. And that would be really great if we could be the ones to say what's best practice, but then translate that into regulation, because to my knowledge right now, and you can all differ, there is no real regulation on it. And that is alarming, especially since I'm still working at the bedside. I don't want some AI thing regulating my Levofed for me, okay? You know, taking all the information, and then I walk in and it's been changed. And that may sound, doesn't mean anything to you guys, but that's what it could ultimately be at the bedside, is some computer taking over for me while I'm not looking, okay? And then lastly, I have a question about the survey that you're gonna put out. Like, what kind of questions are gonna be, or am I jumping the gun? I'm just curious as to what you're gonna be asking everybody.
That's still under development.
Okay, that's a
Yes.
fair response.
Yes.
But categories, I mean, and is it everybody that are you going out to the general population?
No, I think
or-
we're talking about a faculty
Oh,
survey
wow.
that's more internally facing at
okay.
this point. Would you agree, colleagues?
Okay.
Yeah.
I was all excited you're gonna ask the general population what they need, what kind of thing. Okay, fair enough.
Thank you. I will say, just to my own perception on some of these questions, first of all, thank you. I like the process steps. I think a check-in with this group next month to see where you're at, and then in September, to look and have an endorsement of this group makes a lot of sense. So I appreciate that. I think some of the things we will be looking for, is, gosh, what stakeholder involvement, to Regent Turner's question, what stakeholders will be involved? So how many fingerprints can we reliably get on this to inform it all the more? What priorities, are there? What clarity over the priorities will there be? One mentor of mine one time told me years ago, and I've never forgotten it, Penny, you can do all that, you just can't do it all at the same time. So what are your priorities? Because that helps us with a lot of these resourcing questions too, of course. And then and one of the questions that we had in the framework was, what were the measures of your success? So when you focus on what outcomes are we trying to create for the people we serve, then how do you back into those priorities? So I think that those are some of the things, you know, that we'll probably be looking for too. So any further comments or questions? All right, well, we can't thank you enough for all you do and all you represent, you know, and one of the, and I'm one of them, as a proud graduate of professional school here. And thank you for all the expertise and the talent and the enthusiasm you bring to this. I will acknowledge too that we're lucky to have incoming President Dr. Rebecca Cunningham in the audience here. Rebecca, thank you for being here. And you said that this is, you poised it as a big opportunity for our university, and I think that's absolutely what all of us think of it as. So thank you for creating possibilities and opportunities for the state. Thank you. With that, we'll adjourn. There, I did my thing.
No, you didn't.